Hi, my name is Susan. I work for K-State Research and Extension as a family and consumer sciences agent in Shawnee County, Kansas. Part of my job is I'm a senior health insurance counselor for Kansas. That means I provide free, unbiased counseling uh, in, related to Medicare and other insurance for seniors. Today, I am making a video to teach people how to navigate the Medicare.gov Plan Finder during Medicare Part D open enrollment. So if you have Medicare Part A and B and a standalone drug plan, now is the time to shop in prescription drug insurance plans for next year, for 2023. And we advise all people to look at their prescription drug plans every single year. There's a lot of things that change, and it could save you quite a bit of money by changing plans. Open enrollment is October 15th through December 7th, and the selections you make during that time will take effect in 2023. So I am going to share my screen. And take you to the Medicare.gov website, which is where we will look through different prescription plans. So I'm going to scroll down a little bit, go to find health and drug plans. And if you have an account, you can log in right here. But for today's example, I'm going to do a general search. So we want to enter our zip code. And over here, we're going to select drug plans only. If you get any extra help for any of these programs, make sure you click a button. But for today's example, I'm going to click I don't get extra help. I don't get any help from these programs. And we definitely want to look at the cost of plans with our prescriptions entered in. Just because a plan has a low premium doesn't mean it's going to cover your drugs as well as maybe a more expensive plan might. So always enter your prescriptions. For today's example, I'm going to enter 3. We're going to start with entering Synthroid. It's going to tell us that there's a lower cost generic available. But we're going to pretend for this example, we are on the name brand Synthroid. So we'll put brand instead. Make sure you click the dosage that you take. And the plan finder seems to think it's easier to understand, I think, if you put in however many you take in a month, even though you might get a 90-day supply. So we're going to pretend we take 1 a day, so 30, and we'll click the every month button. Do know, though, if you are on certain skin creams or an inhaler that you don't feel very often, you can put like 1 here for an inhaler and then go over here and click every 12 months. We're going to add another prescription. Let's add hydrochlorothiazide. And really pay attention to what you're clicking here because some of these really start to look the same. So pay attention. And it does make a difference on some of these prescriptions price-wise between capsules and tablets. So click the one that you do take. Again, we're going to do 1 a day for a month. And then let's add our statin. One a day. Once we've entered all of our prescriptions, you can click Done Adding Drugs. And then the next part is to enter your pharmacies. If there is only one pharmacy that you're willing to go to or have access to, just put that one in. But know that it's not going to give you probably as many choices, and you might not be able to save as much money as you might if you're willing to go to a different pharmacy. So for this example, we can put quite a few, 4 or 5 of these in. I'm going to just put in the first couple. And then I'm not finding the one I need. So I can either expand my search. Like right now I'm doing 5 miles. I can take it out to 10, or I can type it in up here. And we'll click that. Now the Plan Finder ranks plans in order of least expensive to most expensive, and it uses this number right here. This is the cost of premiums for the entire year, plus your prescriptions if you fill them as we have them entered into the Plan Finder. Now, if you get prescribed something else in the middle of the year, this price will probably go up. So this particular plan, it's going to cost approximately $614.61 for the year for your premiums and your prescriptions. Know that this is an approximate cost. This premium won't change, but the cost of your prescriptions might. So several things I look at is the star rating up here. I look at the premium and of course the total cost. Lots of plans have this deductible. And I like scrolling through and looking at the first couple. This particular plan has a little higher premium. The total's pretty close to what we were looking at there before. And then we've got another plan here. So let's start by looking inside this plan that came up lowest cost. This first part talks about the pharmacies, and I really pay close attention to this. Several of these pharmacies are out of network on this particular plan. Know that they would be in network for other plans. And then we've got 2 preferred pharmacies on this plan. This little chart shows us the yearly drug cost by pharmacy for each prescription. So on the atorvastatin, this is what you would pay for a year if you went to this out-of-network pharmacy. Notice the huge difference in price going to a preferred pharmacy. And so you'll see that price for each prescription for the year. This part shows us the cost of prescriptions for the year, plus the premium costs by pharmacy. Again, a huge price difference. This lets us know when you'd meet the deductible. So if you went to a preferred pharmacy here, you would meet the deductible in November. And on the particular prescriptions we entered, the coverage gap or the donut hole, we will not reach. Okay, this gives us a cost per month of what we would spend on our prescriptions. So we spend close to $51 a month on our prescriptions total. Notice when you get down here to November, when it says that we will reach the deductible, the price changes. And I'll show you more on that. So I'm just going to click one of the preferred pharmacies. This tells us the retail cost of each prescription, what we pay for the prescription before the deductible, and then once this is the cost of each prescription after we've met the deductible. So this is why we see the price change in November, December after we meet the deductible. I'm going to click View More Drug Coverage here. This gives us more information about the plan, the different tiers, and what each tier costs on that plan. And then we can look in our particular prescriptions and see what tier they are. Look to see if they need prior authorization. So one plan might have you have prior authorization and another might not. So that might be something you look at. Prior authorization isn't a huge deal usually. It's just the doctor writing a note that you need that particular prescription. Quite a few plans have quantity limits on their prescriptions. You can click on the yes and it shows you what they are. And then once in a while, you'll see prescriptions that require step therapy. This is a little more involved process. where the insurance company is asking that you try certain prescriptions before you try the particular one you have entered. Know that some insurance companies might require step therapy and others might not. So that might be something to look at on some of your prescriptions. Okay. A few other things I want to show you is you can put several of these plans side by side to look at them that way. I just put the top two. This shows the star ratings of each, the monthly premium, the yearly deductible. Then we can get down here and it shows us the estimated total drug plus premium cost for each plan at each particular pharmacy. All right, once you've decided what plan you'd like to enroll in, just find it, and then you hit the enroll button. Pay attention to what plan you're enrolling in. Like WellCare has several plans this year. Make sure you pay attention to the entire name of it, WellCare Value Script. Pay attention to that premium. Make sure you're enrolling in the right plan that you want to. So you can hit the enroll button. You'll need to have your Medicare card number handy, birthday, address, phone number, and this pretty much walks you through the process. Once you've been enrolled, I think a big thing to remember is to save the confirmation number that they give you on the last page. So you can save that page on your computer, or you can print it off. But hang on to that until you hear from your new insurance company. That should take about 2 weeks. And once you've heard from them, the confirmation page is not quite as big a deal. Now, there are other things to consider that I'm not getting into right now. There's an income-related monthly adjustment where your premium will cost more for your drug plan if you make a certain amount of money. That's something you could look more on Medicare.gov to find out about. This is just kind of some basic information about enrollment. Know that once you enroll in a plan, it will automatically unenroll you from your current plan at the right time. So you don't need to contact your current plan the end of this month to let them know you're leaving. This enrollment process will take care of that. If you look through and you're shopping for plans and you realize you don't want to change, then you just don't need to take any action at all. They'll just keep you in the plan that you're in. I hope you found this video helpful. I'd love to hear about it if you did. If you've got some questions, I'd be glad to answer them. You can email me at sfangman, F-A-N-G-M-A-N, @ksu.edu. But make sure you get your enrollment done for Medicare Part D open enrollment by December 7th. That's your deadline. So good luck, and make sure you check your prescription drug plan every year.